Hello, everyone, and thank you for joining us today. My name is Rachel Wilkinson, Director of Programmes at the International Civil Society Centre. I'm joining you today from our office in Berlin, and I'm the moderator for today's session. I'm delighted that we have digital dialogues as part of our annual Global Perspective event happening today. For the benefit of those who are blind or have a visual impairment, all speakers will begin with a short self-description. So I will start. I am wearing a black dress. I am a pale woman with significant amount of silver hair, formerly very dark brown hair, and I'm wearing red lipstick. I'm sat in our Berlin office with a beautiful branded banner behind me, and I am your moderator for today's session. Digital Dialogues, for those who don't know, is a series of discussions where we explore civil society's perspectives on various digital emerging issues. Today's discussion topic is focused about mental health in the digital age. As we know, digital technology and social media platforms have offered massive amounts of ways for us to connect communities, but there's also another side to digital technology. Research and reviews on the impact mental health has on workers has been done by quite a few different organisations, a few different academic bodies, and the EU compiled various published research a couple of years ago, and their overall suggestion was that in the workplace today, the predominance of tech has increased the probability for fatigue and burnout. That hyperconnectivity can add to the workload and add to stress. The continuous demands that technological adaptations can be psychologically detrimental. In addition, intrusive digital technologies that are now in our homes 24/7 can add to anxiety and isolation. Working with digital technology increases the probability of burnout. It can also negatively impact our quality of life, and it can provoke techno addiction. It is not necessarily technology per se that is causing this harm, rather more how we are engaging and using digital technology in our lives and in our workplaces. Digital technology is entrenched in almost every part of our personal and working lives. What do we need to be mindful of? How can we mitigate against these potential dangers? What opportunities can digital technology provide to support mental health and provide support for those in need? What questions should we, as civil society organisations, be asking about how we use technology in our working lives? Today, we will hear from our expert panellists, and we will start to unpack some of these questions. To help us discuss these issues and more, we are delighted to welcome to today's panel three wonderful speakers. We have Emily Hewlett from OECD Health Policy Analyst. She's been leading on the OECD's health work since 2012, focusing on mental health. We have Duda Suzic, who is the mental health professional with degree in psychology and counselling at the Office of the UN High Commissioner for Refugees. She is the chief and the Psychosocial Wellbeing Section. We're also delighted to have Christine Ombima, who is the Executive Director and founder of Stand Out for Mental Health, based in Kenya. She has over 5 years' experience in community wellbeing and mental health advocacy, and also has a lived experience of mental health illness. To start us off today, each panellist will introduce themselves and frame the issue by sharing the current landscape and their key points for around about 5 minutes. Then we'll have some discussions and some questions. At any point during the presentations, please do feel free to put your questions into the chat. We won't get to all of them, but we will certainly try. Emily, would you please turn on your camera and join me here? Would you please introduce yourself, sharing your key points, and also please don't forget to start with a brief description.
Thank you very much for the opportunity to be with you today. My name is Emily Hewlett. I work at the Organization for Economic Cooperation and Development, the OECD. I am a white woman with short brown hair, wearing a big headset and glasses, and I have a blurry background, which is from my home office in Paris, where the OECD is based. The OECD has been working on mental health for several years now, and we've seen the impact of different trends impact population mental health, but also governments' responses to these changes in need. I wanted to start today by zooming out and talking not straight away about the question of digital tools, but instead about the trends we see in mental health status more generally. In recent years, we've seen increases in mental distress. This started in the OECD countries, at least, in the pandemic years, but seems to have stuck around afterwards. In countries where data is available, we saw that anxiety and depression increased from 2020 onwards, and that in 2022, prevalence was roughly 20% higher than pre-pandemic levels, and in some countries, it was even higher. We're especially concerned about child and adolescent mental health. That might not be the primary focus of everybody here today, but I do think it's worrying. We're seeing that young people in the pandemic were something like 30 to 80% higher at reporting prevalence or symptoms of depression and anxiety than working age population. And data is not great, but we do think those trends have stuck around after the pandemic. So what do we know about what might be driving this decline in mental health? It's really hard to say, and there are lots of challenging things going on in the world at the moment. From the post-pandemic fallout to global instability to difficulties around cost of living, conflicts and insecurity. But we also know that we're living in a hyper-digitalized environment, unlike anything we've experienced before. And there are some weak signals that suggest that there's a link between really intensely digital environments where we're on our devices all the time and poorer mental health. For example, for children and young people, cyberbullying rates are increasing year on year, and we see some positive benefits when people do a digital detox, although the evidence is a little bit weak there. What about the positives of digitalization for mental health? Because new technology has brought new opportunities, and if there was an area of healthcare that desperately needed new opportunities, it's mental health. We're seeing increased mental health needs, and these digital tools are going to have to be part of the solution. The gap between need and treatment availability was already big, and it might be getting even bigger, even in advanced OECD countries. Digital tools from therapy delivered through teleconsultation or app-based symptom management or education or web-based chat platforms are a lower cost, more accessible way to increase treatment coverage for mental health conditions. There's a lot more to say about the benefits and the risks of digital tools and hyper-digital environments, but let me finish with three main messages for now. First, that mental distress seems to be increasing, and none of us can ignore this as a trend in our lives. We can't ignore either the idea that this might be linked to the huge transformations that digitalization has brought to our social, emotional, and working lives. Second, advanced digitalization means we have to take some steps to protect our mental health. Right to disconnect policies, for example, are a key policy that workplaces should be looking at. And third, digital tools to support mental health hold a lot of promise, but they need the same kind of rigorous quality assurance and careful management that all mental health care demands. And governments, which is the OECD's main audience, but also employers or parents or teachers, depending who you're talking to, have a responsibility to take that critical safety, security, privacy dimension when using digital tools really seriously. I'm really looking forward to the discussion and to getting the opportunity to hear from the other panelists and to see some of your questions. Thanks very much.
Thank you, Emily. If you could turn off your camera now, I would like to welcome Duda to join me on the screen. Hello, Duda. Good afternoon. Please unmute yourself, share your opening comments, and don't forget to start with your short description. Thank you.
So thank you, first of all, for inviting me to this panel and giving me the opportunity to participate in this discussion. I very much look forward for other panelists as well, but also to for the audience to give us their input. So my name is Duda Suzic. I work at the UN High Commissioner for Refugees at the UN Refugee Agency. I am Croatian. I'm a white woman. I have red glasses. Somehow the glasses today seem to be the topic of the introduction. I will not tell you necessarily my age, but I have been working in this area for over 25 years. So I wanted to start also by saying that in my career, I have actually seen this incredible digitalization progress from the time when the personal laptops were an innovation, that is beginning of the 90s, to the emergence of use of emails, which quite revolutionized the way that we were communicating. I remember then talks about the Google search engine and how that has actually changed, and people had different views about, is it useful, is it not useful, but generally everybody was excited about the capacity to find information without having to go to a library or somewhere else. And then, of course, the smartphones, to the latest developments of machine learning, artificial intelligence, etc., etc. And as a mental health professional, of course, it is interesting to see how that digitalization impacts on people in the workplace. And my workplace has been UNHCR for the past number of years. That is on one side. On the other side as well, how do we leverage this technology to bring mental health solution closer to the personnel, closer to our workforce, and therefore also closer to the community in a way. So Emily has already mentioned the advantages that digitalization has brought to the workplace and to our lives in general. But just to kind of summarize that, of course, the increased flexibility. I think we have seen at the time of COVID how digital tools have actually enabled us to continue working, to continue doing the most difficult tasks, even while we are only virtually connected. The other part also, it has brought some efficiencies. We are able to do certain things faster, better. The productivity has a potential to change, and you note my language. There is always the flip side, and I very much insist on using the word potential advantages. And it also, of course, increase the opportunities for inclusion and increase the opportunity for access to information. So there is no question about that. However, we did see as well the pressures that has actually produced on colleagues. So the pressure to always be online, always be available. Probably all of us on call have more than one device, one digital device, and probably we are connected on multiple platforms. That means that we check what is going on. Are we sought for here? How do we keep in touch with the information somewhere else? And so on and so forth. So even in the workforce, in the workplace, that is the same challenge. Do I get the email? Do I get a message through Teams? Do I get a WhatsApp message, or whatever channel, whatever platform we are using? The other side as well is the flexibility. So while the digital tools have allowed us to include working from home, and when you think about just some 10 years back or even 5 years back, that possibility was way less accessible. Today, we can actually say, okay, it is easy to work from home. It doesn't really matter. However, that in excess can actually lead to isolation as well. So we are seeing that as well, that there are kind of breakings of the teams and of the professional communities that also requires different way of working. And finally, I think Emily has mentioned the techno stress, and I think actually Rachel, you in your introduction you also referred to that. How do we make sure that we take everybody on board, that everybody is actually able to use the digital tools at least to the minimum level in the workplace? And this is where we see the differences. Some people are extremely fast. The minute there is a new functionality or new device or new way of new digital method, they are immediately on board and they actually can integrate it very quickly. Some people take it extremely difficult, and some people feel extremely intimidated by that, which means that actually their sense of professional comfort is changing. They need to invest more significant time in adjustment to the new way of working, etc. And that is something that we do need to pay attention to. So these are sort of some of the things that have actually occurred. Of course, what I haven't mentioned yet, this concern about data privacy and surveillance. Emily has touched upon that. That is also something that colleagues are talking about, are becoming more and more aware about, are asking questions. What are the organizational digital tools doing with our information, and so on and so forth. So these are sort of important things to think through as we are going through this discussion further. And I just maybe wanted to add, before I finish, a few comments on how in UNHCR we have used the digital tools to provide some mental health solutions and to bring to colleagues some tools that are leveraging digital technology. As I said, way of using this tool to destigmatize mental health is actually great. We can much faster propagate the information. We can share, we can make the information accessible. We can use the videos, the articles, connect different kind of information to the audience in different corners of the world. And that is extremely important, because we do need to think of all of our personnel, whether they are working at the headquarters locations, at the capital locations, at the locations in the deep field, or in the refugee camps for that matter. How do they access, how do they stay connected to this global conversation on mental health? How do we make sure that we don't remain locked in some headquarter-based conversations that do not eventually affect the life of people who are really working on the front line and who need to get the most support they can? So for that reason, we have joined with other UN organizations something that we call Wellbeing Platform, which is basically a website on which we use for as a depository of all well-being information in a way which is simple, in a way which is engaging, but in a way that doesn't track personal data of colleagues. And that was the key commitment that we actually had. So I can see that my time is coming up, so I will be willing to speak a little bit about that further. But these are sort of some of the things, or some of the ways that we can actually use the digital advancement to help us do the work that we do and to reach the colleagues in the deepest corners of the world. Thank you.
Wonderful. Thank you, Duda. We will definitely get to more questions for you specifically on the tools that you are using. I would like to welcome Christine to join me now on the screen. Christine is currently in Nairobi in Kenya. If you can please turn on your screen, Christine, thank you. And please do remember to start with your brief self-description. Thank you.
Oh, hi everyone. Good morning, good evening, good afternoon. My name is Christine Ombima from Nairobi, Kenya. I am a middle-aged woman, a Black woman. I'm dressed in a black and white dress with a black coat, and my background is a cream wall. So basically, I'm the founder of Stand Out for Mental Health, which is a community-based organization based here in Nairobi, Kenya, in Africa to be precise. And our work mainly is to create mental wellness through dance, art, sports, and fashion. So basically, since mental health has been a taboo in the African society, whereby many people who have a mental illness, myself included, are regarded as a curse, are regarded as a misfit in the society. That's why I took it upon myself to use my story as a way of creating awareness on matters mental wellness. So with regard to today's topic, the discussion that we are going to have in my sharing is more about how community-based organizations or what we call grassroots organizations are doing with regard to digital advocacy in advancing mental wellness. So to begin with, I'll begin with some statistics here in Kenya to be precise, whereby it's said that 500,000 Kenyans have access to only one psychiatrist. That tells you that there is a shortage with regards to mental health professionals in this field. And that's why we have taken it upon ourselves as Stand Out for Mental Health to create awareness with regard to mental illness. We do so through digital campaigns whereby we run social media campaigns on LinkedIn, on X, on Facebook, and also on Instagram, whereby we share up-to-date information with regard to mental health. I can tell you for free that mental health is becoming, the issues of mental health are on the rise. Issues to do with depression, anxiety, psychosis, and also suicide. But we can be able to change the narrative through the work that grassroots organizations are doing in the community. For instance, you can find that there's this person whose mental health institution is quite a distance away. But because we offer up-to-date mental health information that can be accessed via phone, that can be accessed anywhere, you can find that we can be able to save a life. This is to say that from the information that we keep sharing with regards to mental illness, people are better placed to recognize the warning signs, the triggers, and also know how to normalize these conversations in the society. Secondly, advocacy is thriving in our society since we have been able to get our voices heard. We've been able to amplify our voices through the use of social media. Social media has been on the rise, and people, even as they scroll, once they get to see information on mental health, it is really, really important as it allows them to get up-to-date information. Secondly, we run psychosocial support groups on social media. Mostly we have them on WhatsApp, whereby we bring together families of persons with mental illness, mental health professionals, as well as persons with lived experience. We create a family and safe spaces whereby people can be able to share their everyday struggles with regard to mental illness. Also, we share hotlines that they can be able to get information with regard to whatever it is that they're feeling. Picture this, somebody who's struggling with issues to do with suicide, and they get access to information whereby a person can be able to reach out to them, even in the wee hours of the night, whereby they can be able to work with them and allow them to be able to get the kind of help that they need. Therefore, we are bringing mental health services closer home through the interventions that we have in our community. Finally, through the power of storytelling, I got to learn that people are able to relate with mental health issues. They turn from abstract issues to issues that each and every other person can be able to relate with. For instance, I have been able to share my story on various platforms, how I struggled with mental health issues. It took me 8 years to complete a 4-year course because of the mental health struggles that I was going through. However, through my story, many people have been able to be touched. They have been able to access mental health services around their community. And what is better is that we've been able to normalize these conversations in our community and also create safe spaces whereby people can be able to reach out to each other, be accountability partners, and do at least 3 things to be able to help each other. So in conclusion, I can say that the digital space has a lot of potential in encouraging advocacy in the mental health space. I would encourage everyone who is struggling with a mental health issue to just open up and access these mental health services that are in our community. Stand Out for Mental Health is one of those organizations that thrives on lived experience consultancy, whereby we encourage the use of storytelling to be able to create impact in our society with regards to mental health. Thank you.
Wonderful. Thank you, Christine. We're now going to move on to the second part of the dialogue and discussion, and this is going to be an opportunity for the panelists to ask questions to each other. So I now invite all other panelists, Christine, come back, Christine, you're very much needed, all 3 panelists to turn on their cameras and to start asking each other questions about the intersections that they've heard in their work and the current landscape that you're working with mental health and with digital technology and overwhelm. Who would like to start?
I can ask a question to both Duda and Christine, which is maybe in the interactions you have with people in your work, do they have a different attitude about using mental health support tools which are digital versus in person or even on the phone? How does that affect people's attitudes and willingness to talk about their mental health concerns or well-being concerns?
Who should start? Christina, would you like to start? Or shall I? I can maybe just for the trends that we see is that there is a reluctancy to use the digital tools as long as there is no clarity in where this information is going. And as a matter of fact, the more able tool you can have, the more demand for your personal information there is. So it means that at some point you as a user need to take a decision that you are actually agreeing to share, to open up, to make your personal information available in some kind of space. So really kind of being informed about what are the protections around the medium, what are the commitments of the medium, that is extremely important, reading the critics and also professional qualifications or professional reviews of certain digital tools providing mental health services is extremely important. Within the workplace, of course, there is additional question of, is my employer actually accessing the information about my mental health, and will this actually work against my job security? And that is where, as my team that we needed, as we were creating the digital tools, we really had to prioritize both data protection, data privacy. We have gone through extremely stringent processes to really make sure that whatever we are committing to, and for us it is important that colleagues have the access to something that is useful, something that is safe as well, and that they know what to expect. So we have really prioritized that. I don't know if Christine would like to add.
Yes, for me, I will say that issues to do with mental health, I've found that there are those who shy away from in-person engagements. But when it comes to the digital space, you find that they're easy and they're more open to share whatever it is that is troubling them. But now the issue of, with the rise of AI, the issue of digital security comes in, and confidentiality. But from the consent that we normally seek from them, we keep encouraging them that confidentiality is guaranteed, and that we deal with professionals who uphold confidentiality. So in that way, we are able to give them hope that whatever it is that they're sharing will just remain within our spaces. And you find the psychosocial support groups that we normally run on, mostly on WhatsApp, they have enabled us to be able to build trust over time. And they've been able to grow from beyond the digital space to people in a particular area just meeting up and allowing themselves to help each other walk the journey. And I believe that has been able to build trust over time as they've seen the consistency in the work that we do.
I'm wondering if Emily has seen any of such examples. So if Emily, you have your perspective on this question.
My perspective is more from a sort of the concerns of government and the need for any nationally or health system delivered tools to uphold that level of security and privacy, and how critically important that is. I think that's even more challenging where in periods where, or in settings where trust in government might be lower. It's challenging if there's not high comprehension of the technology. So I think that with AI tools, that might become a more complex issue to navigate, both if service users don't necessarily understand how the technology operates and the limits around what it's able to deliver for them, but also health professionals don't necessarily understand how to help their clients through using the tools. We see data security and privacy as a challenge generally. There have been a couple of pretty high profile health data infrastructure hacks, which have really damaged confidence in privacy and security in some countries in particular. And we see that the legacy of those kinds of events is really long in people's confidence in what is being offered to them. So, you know, the first step is to make sure things really, really are secure and protected to the greatest extent possible, and then to communicate around that to everybody who might be using it, and then to support literacy on both ends in terms of the service users and the healthcare professionals to move around in that space. So, yeah.
If I may add actually another kind of concern that is there, and that is actually compliance. And Christine, you have mentioned that you within the community or within amongst people with mental health issues, it is a challenge to come into face-to-face consultation. Sometimes it is the access question, but also that kind of fear of being judged, and you know, sort of you open Pandora box in a sense. But another challenge that we noticed as well is the treatment compliance, because we have seen, you know, there are kind of multiple applications available at different costs, and some of them are super affordable. The question is, are they evidence-based? Of course, that is one that can be easily controlled. But where we noticed is that there is a lot of starting up the process, but not finishing. So, and that is already in mental health treatment, something that, or in any health treatment, something that we want to look at. What is the treatment compliance rate, right? what we have found in UNHCR in one of the programs that we are running, which is actually a program for treatment of early symptoms of burnout and vicarious trauma, runs through 5 sessions, and colleagues can actually do it at their own pace, on their own. There are some kind of reflection exercises and some practice to do. But when that process is accompanied by a counselor who will at least say, hey, how are you doing? Do you need any help? You know, so if I notice that you have actually paused this work, you haven't gone back to it, can we discuss, can I help you come back on track? That this is actually where it works easiest, because so Christine, I'm interested to hear also, what have you noticed in terms of the treatment compliance when there is not this kind of personal encouragement almost?
Okay, for me, what I've realized with regard to treatment compliance, first of all, acceptance that one has a mental condition. It takes many years to be able to accept. One, because of the stigma. Two, because of the nature of mental illness, whereby even accepting that it's a lifelong condition, that you have to take medication, whether you feel good or not. Therefore, you find that people go for the review sessions, take treatment, and when they feel better, they stop taking the medication, which is a myth in itself, because you find that they will end up relapsing really badly, because given that this is a lifelong condition, even if you feel much better, it's only that the doses need to be made lower and not you breaking off from the treatment by yourself. So when it comes to treatment compliance, one, the body changes that come with the medication, they make treatment, remembering that each day you have to walk the journey together with regard to mental illness and also compliance to treatment and medication. Yeah.
Yeah, no, it's interesting. I think also, you know, from the perspective of prevention, actually, Emily has mentioned right at the beginning the policy on right to disconnect. Mm-hmm. And do you have the information on how many how broadly implemented that is, or how many workplaces have something like that?
I definitely don't. It would be great to see, but it would also be very interesting to see if there's a gap between workplaces who encourage the principle of the right to disconnect and workplaces who enforce that in some ways, because I think some of the pressures around connection don't necessarily come from a direct requirement, either organizationally or for people's managers, but rather they come from a sense of drive that people might have, or a sense of obligation, or more complex processes around that. So I'd be very interested to know. I don't know if there are people in the chat maybe who have experiences around this, of how to make the right to disconnect policy as effective as possible, and how that's been implemented practically. I don't know if at the UNHCR this is something that you pursue.
We have started those discussions within the UN context, actually, a number of years back, and it is left at the level of guidance of what is good. But of course, you are talking of organizational work around crisis response and so on, so it becomes a little bit complex. But I would be very interested to hear, because it is actually something we are talking about, being constantly connected as one of the psychosocial risks that can lead to mental health. And that's also, from the prevention perspective, extremely important aspect to look after. And yeah.
Actually, following on from that, Emily, I'm going to, because I have the microphone, I'm going to indulge and ask a question. Has there been any kind of evidence when we've, certain countries have kind of tried to install right to disconnect, or has there been any studies to show that the impact of what that happens when it's done correctly and when it's kind of enforced or generally agreed upon? Could you speak to any information about that?
So at national level, it's so hard to follow up on the impact of these things. Even trying to capture the prevalence of mental health conditions at a national level is really hard, both because of the data collection is not being done, but also when it is done, it's not straightforward to undertake those surveys. So it might be more pertinent to look at the sort of workplace level. We do see like a growing commitment to the idea of the intervention. The OECD has been insisting for many years now on the negative impact that poor mental health has on the workplace and on workplace performance. So it's not just the workplace and environment having an impact on people's mental health, but actually mental health has an impact on productivity, presenteeism, absenteeism, and if people have a mental health condition and they fall out of work, they find it much harder to get back into the workplace. So there are lots of good reasons for governments, for employers to take really significant steps if they can to support people's mental health when they're in work and to support people's return to work when they can. That doesn't directly answer your question, besides saying it's a tricky question to answer and be interesting. But I would be very interested in any other answers that people might have to the same question.
Or perhaps, Christine, could you speak to some specific examples or your experiences in the Kenyan context of how organizations or kind of communities have promoted digital well-being and that having an impact on people's mental health?
Okay, so from what was shared by Emily with regard to hyperdigitalization, what we keep encouraging is having a social media detox, whereby we are encouraging issues with self-care, whereby probably at the end of the week, you can be able to like just log off all social media, take a walk, go to visit a friend, engage in a football match, go for swimming. So probably with regards to digital well-being, that's what we keep encouraging. Also, we keep encouraging safe spaces on social media and shunning any form of cyberbullying. Like we find many organizations are just rallying together, even with the ongoing 16 days of activism against gender-based violence, just as a way of creating awareness on the need of having safe spaces in our families, in our communities, in our places, so that people can be able to know the need of being their brothers at all times. And you see, it all begins also in the digital space, whereby we spend time. If we learn how to be our brothers, even in the digital space, in family, in our communities, and in our workplaces, I think the digital space can be much safer for everyone.
Thank you. We're having a little bit of problems hearing you on our side. Christine, potentially maybe turning your video off might help with the connectivity. But thank you. I think we got quite a lot of information. Oh, we have lost Christine again.
I think she has just turned her video off.
Yes, maybe. Oh yes, true. Wonderful. So Duda, this might be a good time for us to go back to kind of do a circle back onto, you've mentioned a little bit in your answers and you touched on it a bit around the online tools that you have been using at the UNHRC and the importance of privacy, of digital security, making sure that ethical considerations are at the upfront and so important. Perhaps you could talk a little bit more about your experiences and what you've been doing from your side and how that's been going for the UNHRC.
So at UNHCR we have really thought of first of all, how to make sure that we don't duplicate that already exists. But I have to say that somehow one of the challenges that I hear from colleagues is choosing from the multiple sources. When I looked into how many apps do we have, how many mental health apps do we have available across different platforms, the number that came up is 20,000. So go figure which one is the best for me under which circumstances, and there is quite a lot of commercializing and trying to put this forward. We also do see that it helps colleagues to have it contextualized to their work environment, workspace, that they find it easier to use digital tools when they can actually recognize themselves in that context somehow. So that is the motivation behind us working on our own tools. One is related to boosting the resilience of colleagues. So it's something where colleagues can assess themselves, can see which aspects of their resilience they should be working the most, and they are offered certain readings, etc. They're responding to that quite well, but we also see that on the other hand, such programs somehow need to be embedded, linked into the life of the organization, so to speak, into their functions on the daily basis. So because otherwise people are finding also the challenge of time, finding time, choosing time, etc., whether to work on the prevention or whether to work even on their own mental health. So these are sort of some of the things I would be happy to share more, but there are other speakers here as well. I think it is important to hear from them as well.
Thank you. Christine, would you like to speak to that question of how to ensure the online tools that you're using are kind of making sure we're focusing very much on ethical considerations of privacy, of the potential danger of cybersecurity and the new world of AI? Would you have any thoughts on that within your work from Standout Mental Health?
So for this, we are I have a full-time job as a product support associate with a tech firm. So basically what we've been going through is learning more about cybersecurity and how we can use AI responsibly. And I think this has really helped us, even as each day we come up with the content plans, each day we come up with content on AI, we know what it is to share on ChatGPT and what it is not to share, and even the kind of information that we input into the AI, we are able to know. So what I can say is that even as organizations try to leverage on tech for social good with regard to mental wellness, it's really important for the staff in that organization to go through trainings with regard to cybersecurity and also training on issues to do with how to use AI responsibly, and also undergo courses with regard to research ethics, so as to know the limits to which they can be able to use these platforms for social good and also to protect the privacy and confidentiality of their beneficiaries.
Thank you. We've got a couple of questions coming through in the chat, and we've got one from Sadiq and from Raquel, which I think I'm going to put together as one. I'm going to ask Emily, and I don't think Emily's going to have a straightforward answer, but I think your insights would really help the conversation. So we're getting through questions that are basically, okay, how can civil society organizations, how can employers use tools? What tools would you recommend? How can we deliver interventions to people that we work with? I'm sure, Emily, you don't have a list of this is what you should do, but I would welcome your thoughts to kind of this bigger question of what do we need to be mindful of CSOs? What should we bear in mind if we want to start looking to use digital technology to support mental health?
Well, I don't have a list, but some countries are coming up with lists. So that might be a good place to start. So Australia, France, Lithuania, Germany, the NHS in England have all started making sort of registries where they suggest digital tools that can be used to support mental health. Some of the best ones give a little bit of information about what those tools do and can be used to support. And they're generally speaking trying to make a selection of tools where the evidence base is strong and they've been through some kind of a clinical evaluation process. So the starting point might be see about buying in access to one of those applications, but thinking through in the first place what kind of quality assurance measures have been taken around that. And that might be a more straightforward way for an employer of a small number of employees to increase access to mental health support without having to take on the responsibility of managing individuals' data and privacy concerns. So sort of enabling access to a third party piece of mental health support might be a place to start. And starting with those sort of evidence-based lists of application would be a good place. As Duda said earlier, there are tens of thousands of applications that exist for various different things. Some of them are really great, some of them, who knows how they were created. So making sure that you do your due diligence in terms of what you're selecting and encouraging people to move towards is really important.
We have time for maybe one more question, which I think I'll put to Duda and Christine. There's a question come in from Belinda around recommendations for data privacy and anonymity to help people, employees feel comfortable. Obviously, this is very complex and very detailed, but if there was any kind of top tips or kind of sort of last words to be mindful of when we're thinking about this important issue, which often does get forgotten about.
Rachel, if you allow me, I just would before that like to add something to what Emily has just said, and that is that as the organizations may be kind of choosing the digital tools for their employees, do include your employees in deciding what is that they want, and secondly, include that tool in some broader well-being strategy for your organization. So because no tool will be panacea for all the mental health related problems, and it is really important to, whatever you do, you know what you have chosen, you know what is that impact of that one choice that you have made. So I really just wanted to briefly emphasize that on the data privacy and the data protection, this is the whole new field, this is a whole new discipline. And it is kind of, there are assessments that are technically conducted on different organizational tools that are being created, data protection and integrity assessments, making sure that the third parties cannot access, making some kind of determinations of how long, if there is any data kept inside, how long this data is kept for, where is it kept for, etc. I'm probably not the best person to speak, but if anybody afterwards want me to connect bilaterally on that, I would be very happy to share our experience around this.
Wonderful. Christine, would you have any final quick words around any of the questions that we've come from the panel and from the chat before we close?
What I can say with regard to different tools that are used for well-being, most of them are found on Play Store. And normally a lot of this information is out there on the internet on which tools are useful in our day-to-day lives. And what I love about the well-being tools that are available for use, they are things that you can be able to do by yourself. If it is deep breathing or even mindfulness, they really help you in your everyday life. So, but when it comes to issues to do with privacy and confidentiality, I can say that one needs also to be very careful with the kind of information that they input on these tools. Yeah.
Thank you. Sadly, we are fast running out of time. We've heard a lot today. We've heard that mental health issues are increasing. This is likely indeed linked to our digital technology and the transformational aspect this is having on our lives. We've heard there's some certain aspects around right to disconnect, that there are digital tools that are out there that can support along with humans, along with an integrated wellbeing plan. They do need to be rigorous with the processes that we use. Data privacy, security, surveillance, these are all huge aspects that need to be taken very seriously when we look as CSOs or as employers to try and support digital well-being and to promote mental health well-being. We've also heard how social media and online tools can do a great job in helping destigmatize the challenges and the kind of demystifying mental health and what's out there and how it affects everybody, and the power of storytelling, which, yes, absolutely agree with, how the powerful message of storytelling can help break down those barriers and help raise awareness about the importance of mental health and mental well-being. Yeah, we've heard a lot from our different panelists. There's been a lot of discussion, a lot of synergy around, yes, it's how we use these tools, and let's be mindful together to make sure that we are using technology and technology isn't using us. I would like to thank everybody for taking part today, our wonderful panelists, and thanks to Emily, to Duda and to Christine. I would also like to thank our interpreters who've done a sterling job. We will be sharing all this information and the resources on the app that we have, and we will also be posting this panel discussion on our website and via the Buva app for the digital dialogues, so people can watch back again. Many thanks to everybody. Have a good day. Bye-bye.
Thank you.